Most of our speech sounds involve a mobile articulator or an active articulator like the tongue blade or the tongue dorsum or the lower lip, relative to some passive articulator like the alveolar ridge or the hard palate or the upper teeth. These articulations create resonances in the nasal, oral, and pharyngeal cavities, with access to the nasal cavity controlled by the velum. And in speech science, you'll talk a little bit about modeling how this resonance works with something like C in the lower right image, where the combination of the nasal cavity, the oral cavity, and the pharyngeal cavity get you sort of an F-shaped series of tubes. Articulation by the velum involves raising the velum toward the posterior pharyngeal wall. This closes off the velopharyngeal port, the passage from the pharyngeal cavity into the nasal cavity. For most speech sounds, the velum is fully raised, causing there to only be resonance in the pharyngeal and the oral cavities for that speech articulation. The velum is lowered relative to that raised position for nasal sounds to add a nasal resonance to the speech that makes nasal sounds distinct. The normal position of the velum is even lower, allowing for easy respiration, easy airflow through the nasal cavity. Articulation of the jaw is through a hinge at the temporomandibular joint, a joint from the jaw in the temporal bone. When the jaw is raised, the tongue and the lower lip are also raised as they are connected to the jaw and supported by it. In the lower right of this image, we have a jaw movement from the dotted position raised to the solid position where it's lowered for the word saw and S consonant, to an ah or aw vowel depending on your particular dialect. So lowering of the jaw or raising of the jaw helps have the consonant and vowel articulations take place. The tongue is our most complicated articulator. It is described anatomically as a muscular hydrostat, which basically means it's kind of like a water balloon. It doesn't have any hard structures in it. It can change its shape, but if you squeeze it in one part, something else is going to have to stick out in order to maintain the volume. In the upper right image, we have the tongue in the context of the other articulators. And in blue, we have structures outside of the midline that would be lateral to the tongue, shown here. This image was made by tracing an X-ray of the vocal tract in a person. The lower image shows subdivisions of the tongue into 5 different functional articulatory units. Most of the bulk of the tongue, marked by A, is the tongue body. At the very front of the tongue near the teeth is B, the tongue tip. Just behind the tip is C, the tongue blade. The remaining part of the surface of the tongue that's in the oral cavity is the tongue dorsum, and the surface of the tongue in the pharyngeal cavity is the tongue root. The tongue body is used as an articulator for our vowels. This involves moving the mass of the tongue around within the oral and pharyngeal space. In anatomy, you learned about the extrinsic tongue muscles that make this movement happen, like the hyoglossus and the genioglossus, the styloglossus and the paladoglossus. The different possible movements give us high versus low and front versus back vowels, where there's kind of an angled or a tilted axis that defines what's high versus low and front versus back. It's not just completely up, down, and left, right. The high front vowel E, as in heat, is indicated with the small dotted line. The low front vowel A, as in hat, is indicated with the darkest solid line. The high back vowel oo, as in hoot, is indicated with the thinner solid line. And the low back vowel, where there's a significant constriction in the pharyngeal space, ah, as in hot, is shown in the thicker dashed line. The other tongue articulators, like the tongue tip, blade, dorsum, and root, are used for various consonants primarily. For the tongue tip are interdental sounds like th and the, as well as our alveolar sounds like t, d, s, z, n, and l. All involve articulation of the tongue tip near the roof of the mouth in the front. The tongue blade is used for our post-alveolar or palatal sounds, like sh, zh, ch, j, y, and r. The tongue dorsum is used for our velar sounds, k, g, and the nasal ng. And the tongue root is a contributor to how the R sound sounds, as well as the low vowels, but some of that articulation was only relatively recently discovered. Hello, Finn. Was only relatively recently discovered by imaging techniques that allow us to look inside the vocal tract better. So they haven't quite made their way into the articulatory descriptions for speech sounds, which were generated before we had such things. Our final articulator is the lips. The lower lip is generally considered the mobile articulator. It moves along with the jaw. In the upper right, we have a series of images from left to right that show the release of a P sound in 5 millisecond intervals, going from closure for the stop to open for the release of the stop. In our bilabial sounds, the passive articulator is the upper lip. This happens in b, p, m, w, and r, as well as the rounded vowels. When the lips come together, generally the lower lip moves more than the upper lip. And in the case of these rounded vowels especially, there's not just bringing the lips together, but they are also protruded. In image B, in kind of the middle right, there's a series of lines indicating the movement of the lips for rounding and protrusion in 20 millisecond intervals for something like an oo vowel. This has an acoustic effect of lengthening the vocal tract, as shown in image C, which you would discuss in speech science. Lips are also involved in our labiodental sounds, where the lower lip moves against the upper teeth for f and v.